Malaria is an important disease. Australia's doing its part. Successive governments have always been very supportive at state and federal level in recognising our commitments in the area. It's a huge disease for our region. We have the capacity to show leadership. We have very, very strong malaria intellectual capacity and globally significant. I'm delighted to see that it's supported and continue to do so, and I think that we can be collectively proud of our efforts to address ourselves to such an important global issue. People most at risk for malaria around the world, essentially it's a disease of poverty, so poor people, women and children, and people who are exposed occupationally, and of course, bearing in mind it's a disease. The distribution is determined by climate because it lives in mosquitoes and because mosquitoes are sensitive to climate. So the mosquito species that transmit malaria are predominantly found in warm and humid conditions, and that's why malaria is predominantly a tropical disease. I think that there are two really big hurdles in tackling malaria. The primary one is the complexity, the biology itself. Malaria is a pathogen which is uniquely well suited to exploiting the human host. Has a long evolutionary history and has learned many, many tricks about how to sort of avoid being dealt with by the body. So it's spread by mosquitoes, but it can rapidly, after an infected mosquito bites you, it rapidly gets into the liver, where it hides in the liver, it can stay there a long time. When it comes out in the blood, it's capable of changing its spots. There's lots of different types and species of malaria and lots of different variants and strains of it. So all of that complex biology makes it really very difficult to get to grips with. It's uniquely able to adapt itself to transmit in different settings around the world. So everywhere, when it comes to malaria, it's all locally specialised, locally differentiated, and difficult to get to grips with for that reason. I think that's the most important thing, that it's a complex and very sophisticated pathogen. The other big hurdle for getting to grips with malaria is just the complexity that we face as humans in organisationally, politically and socially, in getting the right conditions we need to be able to apply this highly local requirements on a global scale. Malaria will always thrive where governments, societies, organisations and individuals fail to take responsibility. So I've devoted most of my adult career to developing vaccines against malaria, which I think is a worthwhile thing to do, even though it's a long haul to get there. Malaria is an incredibly complicated beast that is capable of thriving in all sorts of different conditions. So it's we think that in principle it should be possible to develop a vaccine against malaria, but in practice that's really quite difficult. You need to be able to achieve a lot of different things with the malaria vaccine. You need to be able to prevent somebody from getting disease. You'd ideally like to prevent them from getting an infection. If you can't stop them getting infection, at least disease. But you'd also ideally like to prevent people from spreading it onwards to mosquitoes when they're bitten by mosquitoes. So each of these requirements has, from a vaccine perspective, built in a lot of functionality that's required. So both vaccines that I'm attempting to develop are vaccines which address all the broad spectrum of activities that would be required for a malaria vaccine. So there's still plenty of opportunity and need to continue to work on developing superior vaccines. So I wanted to take on something big, but also something that just possibly I may be able to make a difference. And I believe that's true with malaria. I think that malaria is certainly, I've alluded to many times, a very significant disease, but also one that we may just manage to really make a difference.